Good morning and welcome back to FlexWell. I hope you enjoyed the segment at the gym. Today we have with us Nora Wahba, who is a physiotherapist specializing in women's health. Noor, welcome back to the show.
Thank you so much, Rajay. I'm happy to be here.
It's wonderful to have you. Now, we've spoken before a bit about issues with postpartum and women's recovery, and I want to ask you about something that a lot of women suffer with, which is if they don't go through a more natural birth, they have a C-section.
Right.
Could you tell us more about this?
Yes. So as you know, C-section in the end, it's a surgery. So the body will go through an incision, opening of so many layers in her body. So of course, the healing will take longer than just a normal delivery. And that healing, taking longer, will cause some pain for the woman, actually a lot of pain, because recovering from the C-section is more painful and a little more difficult than recovering from the normal delivery. Although now the new ways are, with the new techniques from the doctors, it's a little bit easier than before, but it's still a surgery in the end.
Well, that makes sense because natural birth, the body is equipped to deal with.
Exactly.
It's what nature intended in a way for the woman to go through.
Correct.
C-section is a way to prevent other complications or other issues.
Yes.
But as you said, it's a surgery.
Right.
And I actually heard that it is very painful.
It is very painful, especially in the first 3 days after having this surgery. So the woman will feel like she's overwhelmed, a new baby. She has to lactate the baby. She has to take care of herself. She cannot sit. She cannot walk. And of course, she's done the surgery under anesthesia. So still the body is getting back to normal. She's not having sense, full sense, until a few hours or sometimes 12 hours or more, depending on what kind of anesthesia she took. So I can give some advices or tips for the woman to have less pain and to know how to deal with that pain that will come just straightly after birth.
Please do, because most women straight after C-section, if they need some time before they can go seek professional help.
Right.
So what do they do in the meantime?
Right. So let's say the woman just delivered C-section. She's in a lot of pain. No more anesthesia, no more painkillers now. She wants to do something that can help her deal with this pain. So most women can do some abdominal breathing the right way. We call it diaphragmatic breathing. It's like taking the air from your nose and blowing your tummy for a few seconds, and then taking the air out from your mouth again. Slowly doing these techniques with breathing, and then a little bit, this can help her to deal with the pain of her stomach and her incision.
Oh, really? Because I would have thought breathing into the belly would cause more pain, just
No,
because of the area where the C-section is.
No, actually, this can help her deal with the pain more. Of course, she has to be gentle, slow, little by little, because once the woman, don't forget, she was pregnant. All her anatomy was different, and then suddenly she gave birth. So still the uterus, everything is not back in the place again. So she will feel something heavy pulling her, pain. So the breathing will help the contraction be less. The uterus slowly come to the normal place, slow by slow. Not everything will be back to normal by one night or 2 nights. It has to be gradual and slow, but this technique will help her at least deal with that pain. And then she will be asked to walk the next day. And I really advise women not to delay walking, even if there is pain. But of course, there are some techniques to start that. She can do some ankle pumps a little bit to ease that swelling, to ease that hormonal changes that are happening in the legs here and there. Also, this can help us reduce the risk of DVT or deep vein thrombosis, because not moving much will increase the risk of thrombosis. So many risks can be avoided when we walk earlier and we move earlier. So women can start with gentle breathing techniques in her bed. She can start with some ankle pumping, some movement of the ankle. We call it leg slides or ankle slides on the bed. She doesn't have to move at that time. Once she feels that the sensation is back to her legs fully and the doctor will give her the consent, she can start. Of course, she can lean on somebody to help her to start at least standing and then sitting, standing and then sitting back, and then taking few steps. If the pain couldn't help her with that, she can of course ask the nurse who's there in the hospital to bring her a walker to lean on it at first, because it's very important, as I told you, not to delay the walking. Slow by slow, she will feel like she can manage the pain. She can take short breaks from here to there, just few steps. 2 to 3 days, she will be totally able to walk.
Oh wow,
Hopefully
just in
by
2 to 3 days.
Yes, most women, if she will follow those techniques, it can help her a lot.
And this is in both women who have natural childbirth and C-section?
Usually in childbirth, naturally, it will be easier for them. Of course, depending if she will have incision or suturing, but mostly it's easier than the C-sections. From my patients and from the people I've dealt with, I've seen that it's easier in the normal than in the C-section, and even the recovery is faster. But those techniques can be done in both actually. But C-section woman will need to take care more about her wound. She will look for signs of infection, any smell that she will not like. She has to tell all of this to her doctor first. If after the 6 weeks to 8 weeks and she still have problems with her C-section incision or scar, she's not feeling like it's healing well, she feels some numbness and the sensation there is not totally normal, we can help her in so many techniques, manual techniques, massaging techniques, to avoid any adhesions or that will cause any pain inside the scar.
Well, that's really good to know. And thank you, Noor.
Thank you so much.
We're going to go on a short break, and then I hope we can talk about this in more detail.
Sure.
Stay tuned for after the break. Welcome back from that short break. Noor, we were talking about postpartum, specifically C-sections, and how it affects the women after they give birth. And we were talking a bit about how important it is to go back to walking, and how within 2 to 3 days you should be able to walk almost normally. But what about other forms of exercise? When is it safe for women to exercise again after the situation?
It's always good to consult with her OB/GYN doctor, but if she doesn't have any issues, she should be fine to get back to exercise like within 6 weeks. But of course, even before that, gentle techniques, gentle range of motion exercises, walking should never be inhibited in any woman unless she's having something serious. Like she can start walking the next day after the surgery. She can also do those techniques in the bed. Don't forget that this woman is having a new baby that she has to take care of. So, but it's mostly important, like during exercising or during moving in the house, she makes sure that she's not putting any pressure, if in case she's having C-section, on her incision and on her pelvic floor muscles. So just to be making sure that the posture is good, using corrective postures, using or walking without putting any extra pressure, because the body needs also time to heal to get back to fully recovered after.
Well, as you mentioned, the woman has a baby to look after.
Yes.
So how does she manage like the surgery and holding a baby or dealing with the things that it needs?
So mostly the woman with C-section, at first she will not feel comfortable sleeping. So during the sleeping, it's recommended to put a pillow at the place of the incision or the C-section surgery. This can help. This little pressure can help her to avoid numbness, help with the healing. Of course, like sleeping position can be so many different. Like she can sleep on her side with some pillows between her knees, one under her head. This is for the sleeping. When she's taking care of the baby, for example, if she wants to change for the baby after a bath, it's recommended to put the baby in a high changing chair, so she doesn't have to bend much. She can do it standing. Of course, it's always recommended to get some help for the woman. She can sleep when she can. If she wants to breastfeed or to lactate the baby, it's also recommended to put some pillows under her elbow while she's sitting, and or she can use a feeding pillow. to make sure like also her neck, her posture, all align with the good posture, to not cause any more pressure on the neck, on the back, or on her incision after the surgery.
Well, that's really good to know. And I think a lot of women do have help from family members and support in the situation.
Very important.
It is very important. But as you said, it's also important for the woman to remain active.
Yes.
And I think especially in some cultures, the idea is that the woman after they give birth should be completely bedridden or not leave the bed or do any activity. So why is this a misconception?
So it depends from culture to another, but let's remember that delivery and pregnancy, it's a blessing. It's not that the woman just became paralyzed or
very true,
or unable to move. But of course, she will get tired. So recovery will take time. But this does not mean like just sleeping all the time and not moving from the bed, because not doing anything will not regain the full recovery for her body. Those muscles, they are gone through a lot from pregnancy, hormonal changes, birth, healing, but the healing will not come by itself. You need to move in order to heal. The more she moves, the more she exercises in a healthy way, she can take the advice from the specialist, but the more she's moving, the more the healing will be faster in her body.
That's really good to know. I think a lot of women have this idea, or they're told by older family members, don't move, stay in bed, rest more.
Exactly.
But the idea that you heal faster when you move is, I think, not as commonly known.
Right, it's not only moving. Like now the surgeries are not like before. Before, like when the woman wanted to do a C-section surgery, she was not allowed to take a shower. She was not allowed like anything to touch this incision in her stomach. But now with the newer suturing techniques and the surgeons who are better than before, now she can even shower from the next day in some techniques, in some suturing techniques.
Really, the next day?
Of course, it depends from surgery to another, but I've seen some gynecologists and obstetric doctors asking the woman to remove the plaster and put some water in the wound or the place of the surgery to make it the sensation come back faster and heal faster. So from a generation to another, we're having better ways of surgeries and of techniques and of recovery. The same of our body. Of course, our grandparents, they thought like not moving would be better for the body, but as the science is updating and everything, we are seeing that women who move earlier and exercise earlier and walk earlier get less concerns and less issues with their pelvic floor and their muscles, and they recover even faster.
That's a really great point. I think that's something a lot of people are not aware of, so thank you for sharing that.
Yes.
And is there anything else women should know after a C-section? Can they make a full recovery always?
Of course, always we can make a full recovery. Always, like all the time, I recommend the woman to do a checkup after 6 weeks, because sometimes, because as you said, like there are so misconceptions. So sometimes there's something she might think it's normal while it's not. So we can just do a general checkup and tell her not all women will need treatment. Some of them can benefit from an advice if they knew there is something wrong or something. So that's why I always advise to do a checkup, even if she's fully healthy. Even like I have athletes, they come after 6 weeks and they want just an advice, when can I go back to this and when can I go back to this? So it's always healthy to do a checkup. Why not?
I mean, that makes a lot of sense. And I want to thank you, Nora, for shedding awareness on this topic, for the advice you just shared with us.
Thank you so much.
And thank you for joining us today.
It's my pleasure. Thank you.
And I hope you guys learned a lot from the episode today, especially in terms of postpartum. And if you have a C-section or know anyone who had a C-section, please recommend them to always get a checkup and get medical help, no matter if it was right after the surgery or 6 weeks, as Noor so eloquently said. It's always safe to just check whether you have issues or not. And contrary to popular belief, movement is good, movement is medicine. So always walk and try your best slowly to get back to where you used to be, and that should speed up your recovery. Thank you for joining us today. We'll see you next time.